Hi everyone, thanks for listening to our presentations. Today I'll be talking about Lorazepam. Lorazepam. Depending on your jurisdiction and the available brand in your country, Lorazepam could be having the brand name known as Ativan, Lorazepam Intenso, Apple Lorazepam, Dom Lorazepam, PMS Lorazepam, Pro Lorazepam, or whatever Lorazepam, and so on. It belongs to a class of medications known as benzodiazepine. It is an anticonvulsant. Lorazepam could appear in different dosage forms. A solution for injection under the brand name Ativan or the generic Lorazepam. You can find solution for injection at 2 mg per ml or 4 mg per ml. The same Ativan or generic could be in tablet form at 0.5 mg, 1 mg, or 2 mg per tablet. Also, Lorazepam Intenso or the generic could be in form of oral solution as 2 mg per ml. Administration. You could administer Lorazepam intramuscularly, but let it be deep intramuscular injection. You can give Lorazepam intravenously, but dilute appropriately, please. And you give very slowly at about 2 mg per minute or 0.05 mg per kilogram over 2 to 5 minutes. Please avoid extravasation. When you give per oral solution, please use the calibrated dropper. Put in water, juice, soda, applesauce, or pudding. Subcutaneous route is also applicable as it is convenient for you. You can give Lorazepam per rectal if it is convenient, and you can use injectable form for rectal purpose. Sublingual administration can also be in form of sublingual tablets, or you can use the oral tablet administered such sublingually, meaning you can give sublingual tablet that will be manufactured directly for that, or you use the oral tablet underneath the tongue. Uses of Lorazepam. Lorazepam is pretty useful in handling many medical conditions. And let's go through the list here. Akathisia might be secondary to neuroleptics. Anxiety as anxiolytics. Agitation. Advanced cancer. Palliative care. Phobia or performance anxiety. Some use propranolol for the same purpose. Pre-surgery anti-anxiety or anxiolytic agent. Catatonia. Chemotherapy induced nausea and vomiting. Here, you can use Lorazepam for prevention of the chemotherapy induced nausea and vomiting or the treatment. Still on uses, Lorazepam will be very helpful to handle insomnia, cocaine intoxication, methamphetamine intoxication, neuroleptic malignant syndrome, and those on neuroleptics are now developing extrapyramidal side effects like akathisia, seizures, serotonin toxicity, alcohol withdrawal, opioid withdrawal, vertigo. Adverse reactions: drowsiness, sedation, hypotension, dizziness, unsteadiness, abnormal gait, stupor, asthenia, and of course, respiratory failure and hypoventilation. Other possible adverse reactions will include dependency, euphoria, hypothermia, suicidal ideation, vertigo, withdrawal syndrome or benzodiazepine withdrawal syndrome, alopecia, skin rash. Others will include impotency, syndrome of inappropriate antidiuretic hormone, hyponatremia, agranulocytosis, visual disturbance, exacerbation of chronic obstructive pulmonary disease, cerebral edema, and so on. What are the possible contraindications? If there is hypersensitivity to lorazepam or sensitivity to any component of the formulation, don't use it. In anyone with history of narrow angle glaucoma, don't use it. Respiratory failure, no lorazepam or any benzodiazepine. In sleep apnea, please don't kill that man or woman anymore. In premature infants, no lorazepam. In myasthenia gravis, keep it off the table. Warning. As a benzodiazepine, we must be careful because concomitant use with opioids may result in profound sedation, respiratory depression, coma, and death. Let me repeat. Any benzodiazepine, the class to which lorazepam belongs, should not be used concomitantly with opioids because we stand the risk of more sedation, severe respiratory depression, coma, and even possibly death. Must use the lowest effective dose and follow up for respiratory depression and sedation. Still on warnings. Anterograde amnesia, and that will be useful in anesthesia or pre-surgery. Let me explain. Here, the individual will not be able to remember or create new memories after the administration of this medication or after the effect has reached the central nervous system. But past events before then will be intact in the memory. So it will be helpful if an individual has taken lorazepam and is having anterograde amnesia and the individual took it purposely pre-surgery so that he or she would not remember the events around the surgery. Central nervous depression is possible, paradoxical aggression, particularly when we're using it to suppress agitation. We should remember there's likelihood of paradoxical aggression. There is likelihood of sleep driving, sleep cooking, sleep eating. So we should watch out. Drug abuse and risk of dependence. You could see that I color that red because it's a big concern. And that is why some of us are not comfortable to place anyone on benzodiazepine, for example, lorazepam, on long-term basis. It can worsen hepatic encephalopathy. As a matter of fact, in any world where hepatic encephalopathy is diagnosed, there will be a warning sign, keep all benzodiazepine off. Still on warnings, it can worsen depression and suicide. It is bad for chronic obstructive pulmonary disease and sleep apnea. You could see that I've repeated sleep apnea twice here. It is not good with opioids at the same time because it's going to worsen sedation, respiratory depression, coma, and possibly death. We have to start low, particularly in debilitated patients. And more importantly, we don't use it at all in elderly. if it is possible to avoid it. In status epilepticus, we have to monitor for respiratory depression or we get the ventilator. Still on warnings, when used pre-anesthesia, we have to be prepared for ventilatory support. May actually worsen insomnia, so it's not the best medication for a long-term treatment of insomnia. Withdrawal symptoms will follow a sudden stoppage. Please decrease slowly before finally discontinuing lorazepam. If you check my presentation on prednisone, I made similar appeal. No sudden stoppage of prednisone. Why that? Because of hypothalamic pituitary adrenal axis failure. Still on warnings, it's very likely that there will be cognitive impairment and behavioral issues in pediatric age group, particularly those less than 3 years old. There might be increased activities like attention deficit and apparative disorder, ADHD. Myoclonic JAGs is likely in premature infants. As a matter of fact, it is contraindicated. No lorazepam in premature children. The best thing is to use a low dose and use it for a short period of time, like 3 to 7 days. Or some may be comfortable going as far as 10 days. Drug-drug interaction. I will limit myself to a piece of advice here. Please contact your pharmacist or your clinical pharmacologist. Why that? I may not be able to predict exactly the number of drugs that you may be taking now or you will be taking later on. And the list of possible drug-drug interaction is pretty long. And I cannot go over all of them right here. So, health field is a place for collaboration. No, there's no tree that could make a forest in health field. We are all interrelating and we are depending on one another. So, pharmacists or clinical pharmacologists will help at this stage, drug-drug interaction. Monitoring. We have to monitor the respiratory rate, the heart rate. Why that? I'm afraid of cardiorespiratory depression. Okay? We monitor the blood pressure because of hypotension. Complete blood count, liver function test, LDH, blood urea nitrogen, and creatinine. Examples where we can give lorazepam will be akathisia, and here we can give lorazepam at 0.5 milligram to 1 milligram once daily or twice daily. We can increase up to 10 milligram per day. The second example is while treating anxiety as anxiolytic agent. We can give lorazepam here intramuscularly or intravenously or per oral from 0.5 to 2 milligram every 4 to 6 hours as may be required. The maximum dose here is 10 milligram per day. In agitated patients, you can give lorazepam with haloperidol. But when you give lorazepam with second-generation antipsychotics like olanzapine or risperidone, you don't inject the two together like you would do here. No, you do that separately. And in fact, through different routes. If you give one per oral, you give the other one per IM or IV, but never combining lorazepam with second-generation antipsychotics like olanzapam. But back to this very page, you can give lorazepam with haloperidol. In fact, you can withdraw the two in one syringe and give IM start. And I'm just giving a kind of hypothetical no scenario here. Doesn't mean this is the only dose you can use. Now, depending on your judgment, or you decide with your attending physician. So 1 milligram lorazepam with 0.5 milligram haloperidol can be combined and given IM star. If you choose only lorazepam, then you can give dosage or dosages higher than 1 milligram, like 2 to 4 milligram IM or IV. You may choose to repeat 1 to 2 milligram IM or IV every 30 minutes. Thanks for listening to my presentation. Lorazepam is a good medication, diazepam, or all of them in benzodiazepine group, but we need to be very careful from trying to help the patient to inadvertently killing them. We need to take extra caution in between. That is, go slow, give lower dosage, treat for a short period of time, watch out for signs and symptoms of cardiorespiratory depression, and then watch out for all the warnings that I've given on this page and the more. And if you are still confused, please contact your pharmacist or your clinical pharmacologist. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it.